Hey everyone. So I read a really interesting article this week about a study done at a university in Indiana. And what the study was focused on was certain types of drugs, such as common cough and cold, flu medications, antidepressants, sleep aids. It did mention overactive bladder medications. And that's what really got me interested in reading it because all of you know that I take a medication for that. And they had 451 patients in this study, all generally around the age of 73, so it was an older generation. But what the studies have shown is that these common everyday drugs that we use all the time actually are showing that they lead to an earlier onset of dementia, if not a more severe development of dementia as you get older. That's something that I felt like I wanted to talk about because you don't really think about it. Well, I don't, when you're taking medication, what the long term effects could be. And it really got me thinking because when they mentioned the overactive bladder medication, they specifically mentioned oxybutynin. That was the overactive bladder medication I was on before I had the solifenacine. And these meds that I take for the issues I'm having and for my MS, I don't really think about what could be the long term effects on my brain and my body from taking them after 20, 30 years. Obagio that I take for my MS has really only been available on the market for about 4 years for patients to take. And they did a 2 to 3 year trial, which is pretty common for the drug to see how it works before it's released to the public. But then you wonder, because something's been on the market for such a short time and the study is only done for such a short time, there's really no evidence to show what the long term effects of these drugs are going to be on our body. And I'm sure that no matter what, in most of the drugs that you take, ultimately there's going to be a long-term effect. I hear about a lot of people who are on one MS drug for 15 to 20 years and it stops working completely and they have to take something else. And you really just wonder, for these drugs to stop working for these people, their body is changing and the drug is probably doing something inside of them after so many years that it shouldn't be, and therefore not working. I mean, for myself, is that going to make me stop taking my Obagio and my solifenacine? No, because as I've said, I'm trying to do everything I can to help with my symptoms and help with my MS, but I think it's really important that if you ever are on any sort of drug and you have a big concern with long-term effects, to address it with your doctor. I've never spoken to my specialist or my family doctor about the drugs I'm on and any concerns. And after reading the article about these common drugs that people use every day, especially with it being fall, winter coming, there's going to be thousands of people that take these common cold drugs every day. And I really think that if people knew that there's the possibility of development of dementia at an older age from using these drugs on a regular basis, it would probably make people take a step back and try and find other routes and other ways to help their sickness rather than that. I think that's why a lot of people with MS are very hesitant to use the MS drugs, because they're not sure of the long-term side effects and they want to do natural things to try and help their MS before they take that step and get on a med. So again, it's just something that can be a little bit scary in going forward. I'm going to be more cautious about the drugs that I'm taking. I'm really going to ask more questions. I already do, but I feel like there's more I could look into. When I was on the oxybutynin, do you think I thought to say to my family doctor, what's the long-term effect of this drug? Is this drug going to harm me in the long run? And to be honest, the answer probably would have been no. The answer would not have been, well, it could cause onset of dementia when you become an older age, which if you're telling people that, I think it's going to make them a little bit more hesitant to get on the drug instead of trying something else. So just food for thought. If you go on Google and you search dementia study common drugs, There is a bunch of articles that are going to show up on this study that was done. So I really think that if you're interested, go on, read about it. You can actually look to see what drugs they're specifically saying they believe are having this effect on the older generation. And it's just a really good way to make sure you're keeping yourself safe, keeping your body healthy, and doing what's right for you and your options. So thank you so much for watching. I hope this was some information that everybody can take away from the video and kind of move forward, and be really careful about the drugs that they are taking over the next few months. And I hope you all have a great week, and I'll see you all next Friday.